bioreactor and close it on the assembly.
Close and close.
Then you're
Hereditary angioedema, or HAE attacks, can be quite debilitating. The approval of a treatment like TAKHZYRO represents another significant step forward in what we can offer patients to help manage HAE. We are excited that with TAKHZYRO, we can now offer a subcutaneous prophylactic treatment that requires one injection every 2 weeks. TAKHZYRO is an exciting new therapy. It has demonstrated that it can help reduce the amount of monthly attacks patients experience. I believe it is important for the medical community to change the way we think about prevention. TAKHZYRO can offer a new option to people who are looking for different ways to manage their HAE. I hope more physicians consider the use of prophylactic therapy, like TAKHZYRO, as part of the patient's treatment plans. The patients and physicians in the HAE community have been very active and vocal about wanting new therapies to help manage their condition. The development of TAKHZYRO demonstrates a significant commitment to fulfilling unmet treatment needs.
About TAKHZYRO, lanadelumab-flyo injection. TAKHZYRO is a fully human monoclonal antibody that specifically binds and decreases plasma kallikrein and is indicated for prophylaxis to prevent HAE attacks in patients 12 years and older. TAKHZYRO is formulated for subcutaneous administration and has a half-life of approximately 2 weeks in patients with HAE. TAKHZYRO is intended for self-administration or administration by a caregiver. The patient or caregiver should be trained by a healthcare professional. TAKHZYRO lanadelumab-flyo injection, indication and important safety information. What is TAKHZYRO? TAKHZYRO lanadelumab-flyo is a prescription medicine used to prevent attacks of hereditary angioedema, HAE, in people 12 years of age and older. It is not known if TAKHZYRO is safe and effective in children under 12 years of age. Please see complete important safety information at the end of the video package. Important safety information. TAKHZYRO may cause serious side effects, including allergic reactions. Call your healthcare provider or get emergency help right away if you have any of the following symptoms: wheezing, difficulty breathing, chest tightness, fast heartbeat, faintness, rash, hives. The most common side effects seen with TAKHZYRO were injection site reactions, pain, redness and bruising, upper respiratory infection, and headache. These are not all the possible side effects of TAKHZYRO. For more information, ask your healthcare provider or pharmacist. You may report side effects to the FDA at 1-800-FDA-1088. TAKHZYRO has not been studied in pregnant or breastfeeding women. Talk to your healthcare provider about the risk of taking TAKHZYRO if you are pregnant, plan to be pregnant, are breastfeeding, or plan to breastfeed. Please see TAKHZYRO.com for full prescribing information.